Hello, everyone, and welcome to this webinar on Act on Angina. The main program will provide an update on angina and chronic coronary syndromes that will pave the way for the new international guidelines that will be released in 2024. These are very important guidelines as they will not just give a guidance only for rich countries, but will take into account the need of the different of countries where people may live with a few dollars per day, where probably the national internet healthcare system is not very diffuse and therefore will answer the need of a better care for patients in order to give a guidance on how to provide the best care for patients according to their location. With this program, the Translational Medicine Academy will accomplish the goal of having worldwide experts that will get educated and will be prepared and will be the ambassadors for the education on the new guidelines that will be released at the end of the year. We have an international faculty and I will be joined by Professor Fausto Pinto that will chair the next series of webinar, and regional faculty. Today we have Francisco Padilla, Nilson Lopez, and Olimpio Branca, so from different part of South America. And also we'll have local experts that represent 14 different countries, going from Bahamas to Uruguay in alphabetical order. Now, the first module today will include my introduction, then a focus on the metabolic pathophysiology of angina, and from Francisco Padilla, and a year in chronic coronary syndromes news with an update on the most important publications by Nilson Lopez. At the end of each talk, we'll have a 10-minute discussion, and at the end, we'll have a 25 minutes discussion where all of you will participate and will ask questions. So we encourage discussion. It is important to share the different experience because that will be important in order to build up the best possible education for all our for the future. Then, of course, there will be a certificate of attendance that will be provided by TMA at the end of the webinar. So just before starting, I would like to share with you data from this international survey on angina that we performed together with INOCA. This is a survey on patients' needs and expectations, and also linked with the responses and with the answers that we gathered from doctors. So we had responses from 21 countries. And as you can see, most of the patients represent the patients we see every day. So with the vast majority of patients having high blood pressure, diabetes, and dyslipidemia, 14% having also atrial fibrillation. Now, what is important is that what we've learned, as I showed you the demographic of this population spanned from India to Europe to South America, you see that the way patients report their symptoms are completely different. So they go from pain, tightness of pressure to shortness of breath, nausea, or pain in the neck and jaw. So you can see that apart from overlaps, there is also a different way of reporting angina by different patients. But regardless on how these patients are described their chest pain, you can see that 60% of them are fairly or significantly limited in their daily activity. So that is a significant proportion, and suggests that we need to do better to control chest pain or angina in our patients. Now, when we ask the patients what is the main goal they would like from their angina, from anti-anginal medications. You can see that unlike what we think, that is to prolong life, the most important aim of their treatment is to reduce their angina attacks and avoid the hospitalizations. Prolonged life comes much later, whilst we as doctors tend to be more focused on that. Then when you can also see that most of patients are troubled by a significant number of drugs that they take. I mean, if you take a threshold of 5, which is the threshold that indicates the presence of polypharmacy, you see that more than 50% of patients take from 6 to more than 15 drugs, which is very significant. So one first thing we need to do is to get rid of all those useless medications that our patients are taking besides the cardiovascular drugs. But one important question is the answers that we got from our patients when on their interaction with the healthcare professionals and their participation in the decision-making process. Now, when patients were asked how often the physician explained the test results or the mechanisms that cause angina, you see that 50% answered never or rarely. Then you see also in 30% of cases, they do not discuss difficulties in taking medications. And in 36% of cases, in patients with angina, doctors don't ask about the effect on the number of anginal attacks and their effect on the emotional status and quality of life. And it's in 30% of cases there was no indication lifestyle recommendation, although 50% of patients feel that their physicians discuss with them. So what it came from this important feedbacks is that, first of all, the needs of our patients are different from what we believe they are. They perceive that probably they are not involved in the decision-making of their medical therapy. Now, when we look at the and we asked on which aspect would improve the angina management, they said to have a better follow-up of their symptoms and receive information that are easy to understand. Often we talk too difficult medical terms that are not understood clearly by our patients, and a proportion of patients said that they would like to be involved in the decision-making process. Now, let's see what the professionals felt regarding the way they interact with our patients, with the patients, and usually the first important point is the time that is dedicated to the visits. You can see that in 80% of cases, the visit was between 15 and 30 minutes, but with 30% of patients of doctors that took less than 15 minutes for their visits. Of course, I mean, that will vary from practice to practice, it varies from private practice to national healthcare system. But when the doctors were asked about whether that time was sufficient for patients to understand their conditions, you see that 74% of them said yes. And if you take them and compare with what our patients said, they said that probably they will need to get more information and information that is easily understandable. Again, when we asked the doctors on the objective in the management of stable angina, you see that for them it was very important to prolong life as much as possible, but again, reduce anginal attacks and symptoms. But whilst avoid hospitalizations came much later. So you see there's a different perception from doctors and patients on what are the objectives for the management. And also when doctors were asked what is the most important at the time of diagnosis for them, is they said that is the patient history regarding the chest pain and the cardiac imaging. But also you can see that 25%, they describe the coronary anatomy, whilst we know the coronary anatomy plays no role in the occurrence of angina. Before going to the end, then we asked doctors which approach they take when they start the anti-anginal treatment. And you can see that despite the guidelines, they say that you can start with combination therapy, that the combination therapy is always better because it helps a better control of symptoms. There is still a 53% of patients that start with a stepwise approach with the hemodynamic agents first and then the non-hemodynamic agents later, whilst only 30% start simultaneously the hemodynamic and non-hemodynamic anti-anginal medications. And when they were asked where they see the place of the metabolic agents in the medical treatment, whilst 30% all said that is from the very start, and this is linked to those who would start together. And you see there is still a 36% who say as a second step, and 34% as a third step. So 70% of patients will wait before starting a metabolic agent. And another very interesting answer was what happens when patients do get angina after, regardless of medications. In the vast majority of cases, they say that they refer patients immediately or within 1 month to have a PCI. And in case of persistent symptoms, they say that they take patients to the cath lab to recheck for the stents. So whilst we know that in the vast majority of cases, the recurrence of angina is not related to the restenosis per se, and only 25% re-optimize medical therapy. So you can see that there are important differences in the way our patients and doctors perceive the importance of anti-anginal medications, and but also on the time that is spent with for them to explain the symptoms, to explain the causes of the symptoms and the medications. But what is important is that the objectives for medical therapies are different in patients and doctors. So this was just to give you an introduction and some food for thoughts for later. And we can then now move to discuss this slide eventually during the panel discussion. But we move to Dr. Francisco Padilla from Mexico that will discuss the metabolic pathophysiology of angina. Francisco.